Good evening. Tonight we're going to do an Ask Me Anything. There's some questions submitted ahead of time, so I'll hit those first while people are logging on, and well, there we go. So there's a question, I'll summarize it, that they were talking about, using the nitric oxide test strips, that they had enough nitrates in their diet and with their supplementation, but that the other part of the strip showed that they were low in probiotics, and asked what they could do to improve that side of it. The probiotics that I usually recommend people consider is from a company called MyFitStrip. They're making different gums that have different strains of probiotics in it to help repopulate the nitrate-reducing bacteria. So MyFitStrip, it's available on Amazon as well. They have different versions of it, so just find one that you like. But they're working on a test which will actually be able to test your saliva to see if you have the right nitrate-reducing bacteria. And if you don't, then you would definitely want to consider using these type of gums to try to improve it. And then there was another question that was submitted ahead of time. Somebody said that they're a 30-year-old man with a IVCD, intraventricular conduction delay. What would be the workup? This is one of those cases where the person's symptomatic, requires a lot more. If they're asymptomatic, probably just an echocardiogram to look at the heart size, function, and potentially a Holter monitor to look if there's any arrhythmias with it. The person's not passing out or having exercise intolerance, probably not much more to do with it. But if the left ventricle is dilated or you're having premature ventricular contractions in the Holter, then you need an electrophysiologist to discuss your options. All right, welcome everybody. I answered the two questions that people had submitted outside the usual Ask Me Anything. They were just good ones that I thought people would like to hear the answers to. So now I'll hit the live questions. So I'm not going to go super deep in them because there's a lot of good questions tonight, but somebody's asking how do you reduce apoB. I've probably done, I don't know, there's like 60 podcasts I've talked in the past 2 years that talk about, dyslipidemia, and I've done IG Lives almost every Monday night and talking about it. So go back and look at the archives for you if you want to deep dive in it, especially if you go watch the one I did with Drew Purehead about 9 months ago. That one goes deep into his Boston Heart Lab panel where we talk about apoB. So if you're a hyperproducer of sterols, then that's statins, bempedoic acid, red yeast rice, bergamot. If you're a hyperabsorber of sterols, that's ezetimibe. If neither of those work for you, then the PCSK9 inhibitors like Repatha, Praluent can help, or the oral berberine is a weak oral PCSK9 inhibitor. Those are the starting points. Nutrition-wise, if you're insulin resistant, you got to cut back on your glucose load. And if your saturated fats are raising your lipoproteins, then cut back on your saturated fats. So that's the starting point for apoB in 30 seconds or less. All right. Says for those that can't undergo a lot of preventative testing, what is the one supplement needed? The answer is just going to be sunlight. You don't need any supplements per se. You need full spectrum sunlight to set your circadian rhythms, UVA to improve your nitric oxide release, UVB to improve your vitamin D. So sunlight. If you really are going to do anything with supplements, probably should have something to do to improve nitric oxide availability. All right. What basic labs studies would you like to see PCPs ordering for risk assessment? From a biophysical, so looking at the arteries themselves, CT coronary calcium score would be a good starting point for people. Lab-wise, apoB, high sensitivity CRP, the markers of oxidative stress, so oxidized LDL would be a good one. It's hard to say, what would be the minimal, but I always kind of break it down to 3 buckets. The ones that affect nitric oxide, the ones that affect oxidative stress and inflammation, and then the third bucket is the lipoproteins. Question up about, are all red lights the same? Someone tried to sell them one that reduces wrinkles and sunspots. So no, the red lights aren't all the same. And the way you're asking the question is probably more about photobiomodulation, because this is one of the few nights where I'm actually going to do more light because I'm going to record a podcast right after this, so I have to actually be seen. They're not going to like it. I just had the pure on red light look like sometimes I was doing IG Lives. But sometimes those red lights that I do on IG Lives, those are just overhead red lights. Those are not photobiomodulation panels. But to answer your question, You need to know what wavelength of red light is coming off the device. The second thing is you need to know the irradiance, or what's also known as the power density. That's measured in milliwatts per centimeter squared. So that's essentially like the temperature that comes off the device. Is it a laser beam or is it a flashlight? And then you need to know how far away you're supposed to be from the device. Is it a skin contact device? Is it a panel that they're requesting you be back at least 6 inches because of the EMFs coming off the device? So they're not all the same. So you have to look at the specifications of the website. Ideally, they'd have a third party that does the assessment as well on their settings, and then look at their protocols. Is there a way to get a cholesterol balance test without a doctor's order? Great question. If you saw my story earlier today, I had basically became a pincushion, sticking my fingers, and did a couple different at-home testing for lipids. So I have a cholesterol check machine where you can just get the basic lipid panel. In order to get the cholesterol balance test, that's apoB. You can buy the panel directly from them. That was a little bit more challenging. You had to use a pretty deep lancet to stick your finger, and there's like a little test tube, and you just drip blood into it to get it past the line. I believe you had to put in at least 30 to 40 milliliters of blood. So it took like 5-10 minutes to drip out enough into that tube, and then you put it on ice and then FedEx it out. So I don't have the results on it yet, so I'll let you know how it compares to my traditional Boston Heart Lab panel. But it's apoB is the way to do that at home without a doctor's order. But the biggest challenge, honestly, is what to do with the results. How to improve left ventricular ejection fraction. So the ejection fraction is how much blood is pumped out of the heart with each heartbeat. Normal is between 55 and 70%. The heart is a pump, but it's also a vortexer. It's a hydraulic pump. So if you look at what the quantum biology collective providers are talking about, it's about improving the structured water in your vascular system. So this is going to be red and infrared light, grounding. Those are things that are going to help. Sauna therapy helps. And then, traditional medications. This is more it's the ACE inhibitors, the beta blockers, the spironolactone type medications, and now the medications like Farxiga. What are some signs cortisol is elevated? The person says that they've had trouble getting it ordered in the past. So, cortisol, is normal. The increase early in the morning time, blue light hitting the melanopsin receptors in your eyes causes the brain to know that it's daytime, and cortisol will keep being pumped out. So blue light pumps it out a lot. So high blood sugars, but stress. So if you're a very anxious person, you're often going to be raising your cortisol. If you have low heart rate variability, that would be a sign that you potentially have high cortisol. If you have high blood sugar, another sign you potentially have high cortisol. There are tests you can do that, they're saliva-based, that are probably more sensitive than a lot of the blood-based ones for cortisol. You can get a cortisol waking response, so you spit in a little tube, and you can see your graph of your cortisol levels throughout the day. There's various companies that do the cortisol responses. Question up about how to fix an abnormal heart rhythm. No medications. Completely depends on what heart rhythm it is. Is it an atrial arrhythmia, ventricular arrhythmia? Is it persistent where you're always in it? Is it intermittent? So unknown, but oftentimes try to remove the offending agents if you can. So if it's caffeine, nicotine, alcohol, get those out. If it's poor sleep, find a better way to sleep. If it's lack of sun, get out there and get your circadian rhythms set up. Lack of electrons, get out there and ground. Magnesium deficiency is often very common in people with heart rhythm disturbances, so potentially magnesium supplementation, but we need more context before giving you kind of a full-on protocol for that. I don't know how exactly to answer this for one, so you might have to send me a DM to give me a little bit more context on it, but what is the budget protocol for heart health? It depends on what you're wanting to get assessed. Is it blood labs? Is it vascular testing? Or is it like heart rhythm testing, heart rate variability testing? There's a whole different way to kind of budget it out depending on what you're interested in. But I always talk about, so I always talk about that health is your greatest asset, and you're going to have to invest in your health so you're going to have to continue to invest in your health as you continue to age. So you don't get out of this unscathed. So it's kind of like a pay me now or pay me later. So if you don't invest in your health now, you get sick later, and you get a stent, it's a $50,000 proposition. Bypass surgery is a couple $100,000. So it always depends on what your budget is. Is it now or later? Somebody's asking about what is the best home blood pressure cuff. There's many different vendors. I'm currently playing around with a watch version of it that has an air bladder, relatively accurate compared to my other monitors I have in the office. It has an LED as well to measure blood pressure. So I'm not going to give the name of the device yet until I kind of play around with it a little bit more and get it calibrated. But I typically like Omron, OMRON. They make very good monitors. I personally like the Omron Evolve. It has a sensor in it that records all the values, and then it can send it to your phone, and you can record it and then share it with our office or share it with your doctors. Proven ways to reduce genetic high LPLA. The only proven therapy is apheresis. They take your blood out, put it through a machine, take out the LPA particles, and give you your blood back. That's the only proven therapy. The PCSK9 inhibitors can lower LPA, 25–30%, but is that clinically relevant? That is not well known at this point. You likely have to lower LPA well in excess of 90%. And the newer medications that are being studied, they lower it, 99%. They shut off the kringles from being produced in the liver. So those medicines will be, likely on the market in a year or two. But in the meantime, it's mostly apheresis, if you have access to it, PCSK9 inhibitors a little bit. If you're a woman, estrogen replacement therapy. No, it's not a reason to start estrogen, but it can lower LPA somewhat. Niacin has a marginal effect at best on LPA, and I rarely recommend people use niacin just to try to lower LPA because it doesn't do it very much. So it's kind of an add-on. It was about another patient asking about high LPLA. So same thing as just mentioned. So this one, I'm not going to be able to answer because it sounds like somebody's having some acute symptoms. They've had a history of heart failure, the heart is weakened, and they're having chills. This is not something I can answer and ask me anything. This is what you have to ask your personal doctor, or go to a cardiologist and have them examine you to figure out what the answer is to this one. Somebody, and I don't know if this was continued on from another question, but it was talking about some like echo findings, but it didn't really give me any context. So I don't know exactly what that part means. All right, and then the last one that's pre-submitted is cardiovascular markers that have the greatest impact on gauging cardiovascular disease other than apoB lipoprotein A. Great question. Think about the endothelial glycocalyx and the endothelium as being the protective force field that prevents the plaque from building up in the first place. So there's not great tested yet to look at the glycocalyx. There may be some markers of syndicate 1 that you can assess in your urine or blood that will come, and you can figure out if your glycocalyx is regenerating slower than usual, but that's not really ready for prime time yet. So mostly you got to look at nitric oxide markers. So you can do salivary nitric oxide testing, blood pressure testing. You can do pulse wave velocity testing on your fingertip. Endopat testing looks at nitric oxide reactivity. It's like a stress test for your arteries to tell you how much nitric oxide you can produce. So that is the most critical. Second bucket is the inflammatory markers, so high sensitivity CRP, LPPLA2, myeloperoxidase, oxidized LDL, oxidized phospholipid, apoB, interleukin 6, asymmetric dimethylarginine, symmetric dimethylarginine. These are usual labs that I check on my patients at Apollo Cardiology. It's available on Boston Heart Lab panels and Cleveland Heart Lab panels. And then, lipoprotein-wise, you already got it covered, but often we'll like to see the cholesterol balance test because it can give you ideas of a hyperproduction issue or hyperabsorption issue that's driving the lipids. And then there's a whole host of metabolic markers: uric acid, homocysteine, full thyroid panel, fasting insulin, fasting glucose, A1C. So there are a lot of things that could be there, but the greatest impact probably would be the markers that affect nitric oxide and insulin sensitivity. All right. So I saw a few questions popping up, so thank you guys. So question, how does someone get enough UVA, UVB in the winter? Depends on what latitude you're at. Everybody's different. There are devices that can add UVA back. That's a black light. UVB is a little bit harder. You got to really be careful to not burn yourself with those type of devices. But sun runs, that's probably the best answer. Is if you live at a high latitude, go down further south into the less than the 20th latitude. Go down for 3 or 4 days and soak up a bunch of UVA, UVB, and that'll last you a couple weeks when you go back to the frigid north or wherever you're from. How much grounding is needed? Is there a point where there's not further benefit? Well, just think of the free electrons. There's way more electrons on the Earth than you have, and so that when you're connected to the Earth, you're going to top up. If you were chock full, like a battery, you won't absorb anymore. You can't get too many electrons from grounding. And it's one of those things where how much is needed? The sicker you are, the more you need. The less sick you are, the less you need. It's kind of like the idea that if you're really sick, you probably should be outside every time except for sleeping. Then you actually find a way to ground your bed as well. If you're not that sick, then just check in a few times a day, probably. I assume this is asking my feelings on the difference between lowering lipids through statins versus diet and supplements. It depends on what the question really is asking. Do I always use statins? Absolutely not. But I'm usually shooting for people who get to less than the 20th percentile on their lipoproteins if they have plaque in their arteries already. If it's complete primary prevention, the arteries are healthy, then I'm probably not as concerned about it. But I can continue to monitor, but if they start developing evidence of endothelial dysfunction, then we'll be more aggressive if their diet and their supplements aren't getting them to goal. But I think it's more important to focus on the endothelial glycocalyx and endothelin than it is the lipids. They're important, but think of the others as the force field. The force field's up, the lipoproteins aren't going to damage it as much. What is the best natural remedy for PVCs? Can they be related to hormones? To the second point, absolutely. So sex hormones, cortisol, adrenaline, all those things can have an effect on it. Hyperthyroidism. What is the best natural remedy? It would probably be outside in the sun. The sunlight's a natural calcium channel blocker. All right, so I see Daytona 674. What is the crazy painting behind you? It is a painting in my dining room. Got my house remodeled a year ago, and this is what the interior decorator put up here. I honestly don't know exactly what it is, so some people have some different ideas. I'm not going to give you what I think it looks like, but in the comments you can put what your best guess is what you think it looks like. Does it matter how far the body is from the panels? I assume you mean the photomodulation. It really depends on the panel itself and the radiance. It is somewhat of a made-up number that it's 6 inches away, but more than 2/3 of the light reflects off your body. So if your skin is red, I should back up. The acronym is RATS: reflection, absorption, transmission, scattering. So when light hits the surface, those are the 4 things it can do. So when you see me do the IG lives and the room's lit up red, if I have one of my panels on, that's because the red light's bouncing off my skin. Only 1/3 of it's getting absorbed into the skin and then possibly has access to getting to the mitochondria and activating the 4 cytochrome. So closer up to the panels, the better. That's why probably in the future, I don't know for sure, but I don't think these panels are really going to exist anymore. They're going to have, DC electric devices, which you can put directly on the skin. I think the wraps are going to be much more important because you take away a lot of that reflection. Does the red light need to be in a dark room? If you're doing photomodulation therapy, no, not necessarily. You can, have ambient light coming in as well. Any lifestyle practices that are particularly effective at reducing visceral fat? First, would do some type of testing, like a DEXA scan, to quantify how much visceral fat that you have. The bioimpedance scales, aren't that sensitive at picking that up. They can kind of give you a trend, but they're not that accurate for the most part. So you probably want a DEXA scan or an ultrasound or an MRI to quantify how much visceral fat you have. But it's, what my friend Dr. Lyon talks about, it's muscle-centric medicine. Your muscles are your organs of longevity, and it's doing heavy resistance work and fueling your muscles with the fuels that they need. So that's what I would focus on is, resistance training. Have your muscles take care of that problem. People are not over fat, they're under muscled, according to Dr. Lyon's sayings. What are the consequences of eating too little protein? Well, you're not necessarily wanting to eat protein, but your body needs certain amino acids to be able to build different enzymes and different building blocks for muscles per se. And so if you don't get enough, you can't turn on the molecular machinery. So sarcopenia would be the worst case. You start losing muscle mass because you don't give it enough to repair any of the damage. And how much protein do you need? Bare minimum is probably 90 grams per day, and that's your first meal and your last meal are the ones that are the most important. And those should be somewhere between 30 and 40 grams of protein at each of those meals. But ideally, it's about a gram per pound of your ideal body weight. So if you're 160 pounds and you're not obese, probably shoot for 160 grams of protein a day. Somebody's asking, where did I get the red light from? It really depends on which question you're asking. I don't even know how many red lights I have. I can, in my field of vision right now, I see 1, 2, 3, 4. I have 4 red lights just in my field of vision. I probably have a couple more in the office behind me. And then in my office at Apollo Cardiology, we probably have about 15 different lights. So it depends on which one you're asking about. But if you go to my other website, it's redlightdoc.com. I have videos where I explain how these different panels work, and helmets and watches and patches. And then some of the vendors that I've used their devices, they're listed on that website. So again, it's redlightdoc.com. What is the ideal time of day to do red light therapy at home? Generally, my recommendation is from sun up to sundown. Some people, if they do a lot of PBM, photomodulation at night, it can affect their sleep. It's not the blue light that's affecting sleep, it's just the high lux of the panel sometimes affects some people, not everybody. So, it's one of those cases where, you're a pretty good biohacker. If you figure out, if it affects you at night, don't do it at night. And they're trying to just, I sometimes joke that they're supplements, use it when the sun would be out. So, but when do I mostly do mine? I mostly do mine in the morning time. Is there a certain red light frequency that I recommend? It always depends on what you're being treated for. So if you go into PubMed and type whatever condition you want to treat and type red light therapy, they'll give you the ideas of, like, is it 660, 630, is it 680 nanometers? 660 seems to be pretty consistent at activating cytochrome C oxidase. So most panels and devices will have a 660 nanometer in it, but it really depends on what you're treating. Like if it's a intracranial one, you have to be near infrared for the most part, 8-10 nanometers. All right, so going back to the top of the hour, somebody asked a question about the oral test strips that look at nitric oxide. their nitric oxide levels were good from a nitrate intake standpoint, but the probiotic level was low. They're asking what probiotics might work to improve the oral microbiome. There's a company, MyFitStrip. I don't have any affiliate links or any financial relationships with them, but MyFitStrip has different gums that can help repopulate the oral microbiome, and then those nitrate-reducing bacteria may be able to break down the nitrates better and help you produce more nitric oxide. All right, so there's one last question. I'll answer this one, and then I'll let you guys go for the week. I'll be back next Monday, 6 p.m. Central Time, to do another Ask Me Anything. I got to hop off here. I got to record a podcast with somebody in Europe in a few minutes. I guess they like hearing about circadian rhythms, red light therapy, and apoB over there as well. So the last question of the night is, what are some heart murmur symptoms? Is it possible for patients to hear it? So a heart murmur is just turbulent flow across either the heart valve or the heart structures themselves. So, typically they're not picked up unless somebody puts a stethoscope on you and they can hear it. Now there are some cases where people have thrills, but that's a 4 out of 6 murmur. That's usually going to be like a ventricular septal defect. Sometimes people can hear it without a stethoscope, but most of the time you can't hear it without that. Symptom-wise, it really depends which valve is affected. Is it a regurgitant lesion or a stenotic lesion? But shortness of breath, fatigue, chest pain, those are probably the most 3 common symptoms people would have if they have a significant valvular lesion. All right, and then I'll answer one last one that popped up and then I'll pop off here. So can you overdo nitric oxide? Possibly, but hard to do. Somebody's taking one of the oral dissolving lozenges once a day. That's right within a normal dose. I mean, usually that product's actually used twice a day sometimes. So once a day shouldn't have any problem. So hope you guys enjoyed the Ask Me Anything. I'll be back again, like I said, next Monday, 6 p.m. Central Time. If you want bonus points, go to my DMs and tell me what you think this painting is. If you want to see some of these videos, they're going to always be in these archives, but I'm taking them and I'm putting them on my Instagram channel. On my YouTube channel. It's going to be youtube.com/Dr. Twyman. I'm putting some longer form videos there as well in the near future. So appreciate you guys. Thank you so much for your time and attention, and we'll see you next time.